your
Sorry about that. Congratulations on your new leadership structure, and we are so grateful to all the council members for your support and commitment, and I'm really thrilled to be here today. This is a day we've been waiting for a long time. I'm speaking to you today on behalf of the full leadership committee. We had an executive committee, but we are here on behalf of our leadership team that represented the individuals that Herb talked about. It was a cross-sectional team. We thank you in the executive branch for your leadership and deep commitment in enabling this cross-sector team to identify the individuals who've been homeless the longest and are most medically vulnerable for prioritization and permanent supportive housing. As you all know, studies have found that homeless individuals face a 25-year less life expectancy than those people or individuals who are not homeless. That's a moral driver for us in implementing this campaign. We have been fortunate to be part of a national campaign and benefit from the best practices, and we think that with the possibility of this funding, it'll be able to enable us to create an ideal model for this population that, as Herb said, would cut down on services. It's much less expensive to live in permanent supportive housing than it is to cycle through crisis emergency services. In addition to some of the data that Herb Smith told you, 80 of the individuals that we surveyed have been hospitalized 3 times in the last 12 months. And 86 were considered to be trimorbid, meaning that they suffer from physical, mental health, and active substance use issues. So these are individuals with very complex needs, but also their state, homelessness has a ravaging impact on people's bodies, and it's the longer you're homeless, the more expensive treatment is. The fact that a group of 369 individuals reported 677 inpatient hospitalizations in the year. You can only imagine the cost savings in that. I mean, the incredible use of emergency room services and moving people onto permanent housing will cut down on those costs and save the county considerable resources. And we understand that most of those services are county funded. You'll soon hear from Jasper Young, who's sitting next to me. He's a formerly homeless client who now lives in permanent supportive housing, and you're going to hear about the joy it means to him to now have his own home. He lives in a permanent supportive housing program called CHIP, which was specifically designed for people entering and exiting these systems. Stefan mentioned that, correctional, also hospitalization, and to provide permanent housing. And cut down on costs, as well as a humane kind of program. And we've shown that that model works. The prospect of your generous support in the supplemental appropriations really gives us a chance to develop an ideal model. During the implementation phase of the campaign, we had many subcommittees that worked towards Registry Week, but we also worked towards galvanizing the resources post-Registry Week. And part of that is creating a services model that, as we discussed, can be reimbursed by Medicaid. So thank you. I mean, this represents the first step of ending homelessness for 15 individuals in Montgomery County, not ending their likelihood of dying on the streets if they don't get housing. And it also represents a day to save critical public county funding. And we'd like that funding to still support homeless services, but I understand there are other needs in the county. So thank you so much, and we're incredibly grateful on behalf of the whole team that you have brought this forward.
Thank you so much, Ms. Cindy.